Hey y'all, welcome to my channel, and today we're going to be talking about beta blockers, LOL. This video is a NCLEX prep video and just a refresher for nursing students. If this is something you're interested, please like, comment, and subscribe. Let's get started. So beta blockers blocks the effect of adrenaline on the heart, causing it to slow down, decreasing the blood pressure, decreasing the cardiac workload, and decreasing the oxygen demand within the body. So it helps essentially relax the body. So what are we using what are we using beta blockers for? A lot of times we use it for hypertension, decreasing your blood pressure, heart failure. So if someone has heart failure, their their heart is not working effectively, and it might be working too hard. Arrhythmias, anginas, anxiety. If you have a low dose of a beta blocker, like propanolol, that help with anxiety, and then post MI recovery. Those are common uses for beta blockers. Easiest mnemonic, LOL. Beta blockers end in LOL. Metoprolol, propanolol, betalol. So LOL is your common, easiest way to remember those mnemonics. Okay, let's talk about the beta 1 and the beta 2 receptors. Beta 1 receptors, the best way to remember this is you have one heart and two lungs. So beta 1 receptors are most common and most commonly in the heart. Beta 2 receptors are most commonly utilized in the lungs. So beta 1 receptors increases your heart rate and contractility, and your beta 2 receptors causes bronchodilation. So this is because this becomes very important when we're talking about like asthma and COPD and those types of conditions, knowing the difference between beta 1 and beta 2. Okay, selective versus non-selective. Most beta blockers are cardioselective, so meaning they are mostly mostly affect the heart. So, for example, metoprolol and all the selective, the cardiac selective medication, those are all used in the heart. The non-selective, the propanolol and nadolol, timolol, excuse me. But the non-selective are usually beta blockers and affect both the lungs and the heart. So propanolol, can help with anxiety, but also affect your heart. So selective, cardio, non-selective, both. So non-selective drugs may be also used for bronchospasm as well. Just keeping that in the back of your head. So nursing intervention. So you're going to be checking your blood pressure, checking, heart rate. Hold less than 60. You're going to be holding the blood pressure, the systolic blood pressure. If it's depending on your facility, 90 to 100, we usually call the provider. The provider will usually hold that. Also, telling your patients you want to slowly stand up. You want to prevent orthostatic hypertension and don't move too fast, especially when you've been, in one position for a very long time. Having them tell you if they're having lots of dizzy spells or falls or anything like that, feeling lightheaded, that is also patient education as well. Patient teaching. Sorry, I was getting ahead of myself. Do not stop suddenly. Rise slowly. Monitor your blood pressures and your pulse at home. Report dizziness, wheezing, and beta blockers can also mask hypoglycemia as well. So if you're having someone, you know, being very slow and cold, clammy, that type of stuff. So we're thinking about hypoglycemia. If they're not regularly, they're not a type 2 diabetic or they're not a diabetic, you want to think about that as well. So keep that in the back of your head. NCLEX review. Beta blocker and in LOL. Assess for heart and blood pressure first. Check for bronchospasm and use caution if the patient has asthma or COPD because of the beta 2s. And bradycardia is a most common and major effect of that because you're slowing down. You're slowing down the heart rate, you're decreasing the blood pressure, and that can dip their heart rate below the 60s, and that's something that you need to watch out for. So some high yield drug list for NCLEX. Metoprolol, that's a beta 1 selective. Atenolol is for hypertension. Propranolol, we're using that for anxiety and tremors. Carvedilol, heart, cardiac. Think of that. Cardiac, heart failure. Labetalol, used frequently in hypertension and pregnancy. So these are things that just keeping in the back of your head.